Recently, members of the Armenian American Health Professionals organization gathered at the residence of AAHPO's president, Dr. Larry Najarian, for a fundraising event. The purpose of the fundraiser was to support the important work the organization is doing in the U.S. and Armenia. In his opening remarks, Dr. Larry Najarian welcomed the guests, thanked them for their support, and spoke about the year's future plans, including the annual summer mission to Armenia. On this beautiful autumn day, the guests and supporters of AAHPO gathered under the welcoming roof of Mr. and Mrs. Najarian, not only to raise funds for the organization's work, but also to discuss AAHPO's current and future plans.
This is an event that's to benefit the AAHPO's continuing medical education program in Karabakh, where we've trained over 65% of the healthcare providers in Karabakh. And this has just been a tremendous impact. This summer, I had the privilege of going to Armenia and discussing this program with an assistant to the Minister of Health, as well as with some of the graduates who are participating in this program. And I came away with the conclusion that this program is something that's definitely very wanted and very needed by the doctors in Karabakh. Most importantly, it gives them hope that they're not alone, that they have Armenian colleagues throughout the world that want to share information with them so they can provide the best care to our Armenian brethren in Karabakh as well as in Armenia.
I've been actually one of the founding members of AAHPO organization back in the 80s. And I very much believe in what the purpose of AAHPO is basically to develop the community, the diaspora, and also to do the medical outreach to Armenia, where we can take a lot of these current as well as futuristic medicine to the community where they have no access. And I think what we're doing today to train the doctors to be up to speed with medical care as we are today here is a brilliant idea. If we can do telemedicine and give them what we call webinars to train them would be also ideal, rather than bringing them to Yerevan, which is, I'm sure, very time-consuming for them and costly. So what we can get to the villages would be ideal.
AAHPO, among other many missions, one of the missions we have is to help the young physicians or young medical students to find a residency or to find a job after residency. We have a fundraiser today, and I just heard from our president, Dr. Larry Najarian, that one of the physicians we helped find a pediatric residency program about 7-8 years ago made a sizable donation to us. It was very heartwarming because it shows that we are a Armenian group and Armenians help Armenians. I want to make the medical students and physicians who came from other countries to United States aware that there is a website AAHPO has, aaphpo.org. There is a point there where they can just apply for help. If they need help to find a residency program or a position, AAHPO is there to help them.
I have been with AAHPO since its inception, which was about 23 years before. And we organized with a few people, and it expanded. Now we have over 100 membership. And we are still expanding. We are doing so many things for the community, and we are very proud of our organization, and we are very proud of our president, Larry, who really is the wheeler-dealer of this organization. Without him, I don't think we can do all that we are doing.
The program that AAHPO started almost now 6 years ago for re-educating the physicians in Karabakh has already succeeded in educating almost over 60% of the physicians there. But at this point, the board of AAHPO is seriously considering to start a program also for the nurses, since a lot of the outlying villages have no physician except a clinic with a nurse taking care of all the patients until further help can arise. And it's so important to educate the nurses so that they will be able to know what is the up-to-date treatment of some of the conditions, or have some preceptors at a higher level so that they can call for advice. The program for the nurses hopefully will be started in January.
I'm the only one that's not a medical doctor here. My expertise in another field, but I support AAHPO for two compelling reasons. One of the reasons is because Larry Najarian is a very good friend of mine, and believe it or not, he is one of my students at Johns Hopkins University, where he initiated the Armenian Studies program. That's number one. Number two, many of the membership and the leaders and the organizers of AAHPO are very close and dear friends of mine, and I have great faith and confidence in the affairs that they are conducting both in this country and in Armenia, especially in the later years where they have been training so many young Armenian physicians in the far-flung reaches of Armenia, where access to medical science and medical studies is not readily available. They are doing a tremendous job, and I support them, and I will continue to support them as long as they keep the mission of AAHPO alive.
This vital medical organization works to improve healthcare awareness, increase disease prevention and early detection, foster fellowship and career development of Armenian healthcare professionals, and provide medical support and education to both our local communities and Armenia.